Hello, I'm Dr. Daniel Berman at Cedars-Sinai Medical Center, where I'm the co-director of the Preventive and Consultative Heart Center of Excellence and the director of the SHAPE program. Today we're going to talk about prevention of heart attacks. Coronary artery disease is the #1 cause of death in men and women. Approximately 1 million patients have a heart attack each year. And in half of those patients, they had no idea they had heart disease until the event occurred. And yet, if we knew they had disease, about 80% of those heart attacks could be prevented. Now, generally, patients think about risk factors like cholesterol, high blood pressure, diabetes, smoking, a family history. And doctors put together all those risk factors to come up with global risk scores in individual patients. And they use those to decide what's the likelihood you have disease. But in fact, those risk factors were derived in populations of patients, and they work in populations, but they don't tell us about disease in individual patients. Imaging of atherosclerosis tells us whether an individual patient has disease. The most common test for imaging is the coronary artery calcium scan, performed with a CT scanner. The coronary calcium buildup in the coronary artery means that a patient has coronary artery disease beginning. So this is a personalized approach to medicine. It allows us to do personalized medicine and for an individual patient and their doctor to know that disease is present in that patient. What's the CT calcium scan? It's performed with very low radiation in a single breath, no injection, and a relatively low-cost test. A large number of studies, covering approximately 200,000 patients, have reported the outcomes of patients who've had calcium scans. In these studies, consistently, there's been shown an increase in the risk of heart attack or dying of heart disease for each increasing category of coronary artery calcium. There's been consistent findings that the calcium score provides greater information and augmented information when compared to the global risk scores based on risk factors. As an example of how the scan can change outcomes, we performed a study called the Eisner study at Cedars-Sinai, where 2,000 patients were evaluated. 2/3 had a scan and 1/3 didn't have a scan. All patients were counseled about risk factor modification, where they were in their overall risk, and how they could optimize their outcomes. So what happened? The patients in the scan group compared to the no scan group had a lowering of their cholesterol, had lower blood pressure, and lost weight more often if they were overweight. And in fact, their overall risk score over a 4-year period of time decreased, whereas in the patients without a scan, it increased, as it does in patients with age. So what happens when we get a scan result? It allows the patient to know what they should do. They're more likely to follow appropriate lifestyle modification programs such as diet and exercise. They're more likely to adhere to whatever their doctor prescribes for them. And for the doctor, it tells them which patients need the most aggressive therapies. And occasionally it helps the doctor and the patient find that there's so much abnormality that further testing is needed in order to find out whether bypass surgery or even angioplasty might be needed. The SHAPE program has been established to get the word out to patients and to physicians about the importance of imaging for atherosclerosis in terms of being able to detect this very large number of patients who are at risk and don't even know they're at risk for having cardiac disease. The SHAPE Centers of Excellence allow us to standardize the manner in which the studies are done and what is recommended after a study has been done in an individual patient. So who needs testing? In general, we would suggest that men over 45 and women over 55 who have no known coronary artery disease, but who have at least one additional risk factor beyond their age for having coronary artery disease should be seriously considering having this test. In many instances, the appropriate patient can refer themselves to one of our centers or to other centers for testing. But it's always a good idea to discuss whether the test is appropriate with your individual doctor. Thanks.